Okay, Dr. Diane Mueller, welcome to the Keto Camp
I'm
podcast.
so excited to be here, Ben. Thanks so much.
Thank you for joining me today. You wrote an amazing book. If you're watching on YouTube, I'm going to hold it up. It's called Use Your Mind to Heal Mold and Lyme. It rhymes. How to Harness the Power of the Mind, Body and Functional Medicine Treatments to Heal Lyme, Mold, and Chronic Infections. This book is very important. Please, for those listening and watching, this conversation is very important and life-changing because we love keto and fasting and all that's great. But if you have any of these hidden infections, keto and fasting will not work to the extent you want it to work. And we're going to dive deep into that. Diane's shaking her head because she's like, yep, that's right. I know that as a kid, you struggled with IBS and you went down the conventional routes and commonly misdiagnosed, missing the mark conventional medicine. So share your story and what you did to research outside of that medical box.
Yeah, so basically the IBS stuff started when I was very, very young, and it was chronic constipation. And as I aged and tracked it better, sometimes it was up to 2 weeks that I would go without having a bowel movement. And that was kind of my first intro to conventional medicine doesn't have the answers for everything, because I went to so many people. I got the big old stamp that said IBS, and I was sent on my way. And when my symptoms started getting worse and worse, and I started needing to travel with multiple size pants because I would never know how bloated and distended I was going to be that given day, that was part of what got me into researching things like nutrition and herbs and just alternative ways of doing medicine. So ultimately, the IBS component was what got me into naturopathic medical school as far as my interest. And then my symptoms that led to my profession in Lyme and mold started after that.
Yeah, your story of pain to purpose, how common is it for a lot of practitioners in our space, right? They go through a pain, they discover that the conventional medicine system of treating symptoms doesn't work. They get to the cause and then they want to share that with the rest of the world. And you're doing a good job with that. And why did you decide to dedicate your study in this book to specifically hidden infections like Lyme and mold?
In part because I feel like it's so misunderstood. The chronic infection world is just so misunderstood. So I went through my own journey with it. So at the pinnacle of, say, my symptom picture, I would sometimes have to be carried because I couldn't walk. I was forgetting where I lived. I was having crazy numbness in my hands. And sometimes would have to pull over because I'd be driving and I couldn't even feel the steering wheel, like real scary stuff. And so that was what originally piqued my interest. But what was even interesting in that was just because naturopathic medical school is so similar to conventional medicine in how hard we are pushed. So in school, it was just so easy to really kind of blow it off as medical school syndrome, right? And it really didn't get looked at or addressed too much. And then when I got out and my friends were getting better and they were like, oh, we've recovered from medical school disease, and I was getting worse, that's when I really started doing a lot of research, like largely out of necessity. And then once, doing the research and following other Lyme literate docs in the field and learning more about Lyme and mold in this whole world, of course, then it's like Pandora's box, right? So I open it up and everything just started flooding out with the knowledge and the misinformation that's out there and the updated studies that haven't made their way into the conventional community yet. So it was really kind of like a forced deep dive into the topic initially.
Yeah, and I want to start with mold specifically, and then we'll go to Lyme and some other hidden infections. Personally, I was impacted by mold. I live in Florida, right? So mold's everywhere in Florida. And the house that I used to live in, I didn't know, but it had chronic or a lot of black mold, I should say, hidden black molds. And I remember at that time I was doing keto and fasting. I was doing CrossFit. I actually owned a CrossFit gym at that time. But I was still having to nap in the afternoons. I was still having sleep issues. I was still not feeling right. And then I started to work with Dr. Daniel Pompa, who's my mentor. I'm not sure if you're familiar with
Mm-mm.
Dr. Pompa. Yeah, so he started to ask me questions like, how does your house smell? Do people say it smells like mildew? Or all these questions. And I eventually hired a company to come in and, oh my gosh, mold is in the HVAC. Mold is behind my walls. And I had 8 silver fillings in my mouth, right? So I was like getting banged up. And it really impacted me. And I actually moved out of the house and did an extensive detox. So I saw what it did to my health, and I was in my 20s. I was pretty young, and what it did to improve my health when I got out of the exposure and did a proper detox. So please get into mold, some of the things to pay attention to, commonly missed ways to test it. Let's just dive deep into mold to start the conversation.
Yeah, there's a couple places to start based upon what you are sharing about your own history with it. And the one is just to make sure all your listeners are very clear that when we're talking about mold illness, what we're classically talking about is a genetic anomaly where our immune system is not able to recognize mold toxins. So if we breathe them in, and our immune system doesn't recognize them, the immune system doesn't recognize them, it doesn't remove them, and then the impacts and all the symptomatology that we can go through is based upon the level of mold that's actually entered our system and the lack of the ability of our immune system to remove it. So that's point number one. So everybody understands that. It's also possible we can have things like mold spores growing in our body. So we could have a situation where it's the toxins and the mold. But most classically, we're talking about the toxic overload. Now, one of the points I want to be making sure to touch back on what you said around smelling mold. Smelling mold is awesome in many ways because smelling mold is like an easy way to know it's there. And so that's a great, it's a great first initial question. I think it's like a really important initial question, but I just want to make sure that everybody is aware that while molds, the smell that we're actually smelling is actually volatile organic compounds, VOC, similar to, our VOC paints, right? But not all molds like admit this really large VOC. So there are some molds that you could have growing in your house that are not emitting this. And so the smell test is you can look at it almost like if you smell it, it's a positive test. If you don't smell it, it doesn't really mean anything.
That's a good point. Yeah. And what about the thought? Because I remember him asking me also, like, when you leave your house and go on vacation for a few days, do you feel better when you versus coming back home? How do you feel about that
I
question?
love that question. And again, I think with so many of these questions, we need to be very clear on what they tell us and what they don't tell us. So it's estimated that up to 50% of the buildings in the United States actually have water damage. So if you
Wow.
leave and you go away and you feel better, again, that's like great because that's a positive sign that you don't have mold in your house or something else in your house that's like, or I'm sorry, if you feel better, it's a positive sign you do have mold in your house or something else that's bothering you. But because so many places have mold in them, it's so statistically possible, right? That you could leave and then end up in another moldy place. So if you leave and you're like, I feel exactly the same, it's not telling us, no, you don't have mold there. So good question. It can definitely give us information, like any question that we just have to be clear about what it's telling us and what it's not.
And what are the most, I know there's a whole host of symptoms that can manifest similar to Lyme, right? But what are the most common symptoms that you've seen from mold exposure?
I would say almost in everybody across the board is pain of some sort. And that pain could be fibromyalgia. It could be manifesting as something like rheumatoid. It could be headaches or migraines. So the type of pain is different, but it's almost always there on some level. So that's, I would say, the most statistically common symptom. Chronic fatigue is another big one. So that's usually there. Brain fog is another real common one. So those are oftentimes the top three. But then all sorts of other things because the nervous system gets so dysregulated and there's so much neuroinflammation that happens that we can see like pseudo ALS, we can see pseudo Parkinson's, we can see, really scary stuff like that. And then it can be very simple things such as even digestive problems because we see mold affect the digestive tract. Another thing is women will oftentimes think that they are going through early menopause if they're far away from that date happening, and because it will manifest as so much hormonal dysregulation. It can cause hormonal dysregulation and can lead to things like these really intense hot flashes, waking up drenched in sweat, things that we commonly see in menopause. So to kind of sum this all up, in some ways mold is a great mimicker. There's quite a few things we could put in this category, but mold, the other time I tell people to think about mold because it's the great mimicker beyond even some of these basic symptoms is if you're in a situation where you've had a lot of lab tests done and everything is coming up and it's like, yeah, you're largely normal. Like if you fall into that category and it's like, what else could be doing with like causing this? That's another just like keynote, like nobody knows what's wrong with me. You should probably look into mold.
Fair point. And most people should probably look into mold, like especially if you live in Florida, a very humid place. What is your favorite way? I know there's different ways to test, to have a company come in and test. There's ERMI test, there's this test. What's your favorite method for testing molds?
You know what's a really great task that I actually have will be updated in that book in the second edition is the panel 7 by Envirobinomics. And the panel 7 I really like because it is not just looking at mold, but it's looking at other microorganisms that can actually be found in water damaged buildings. So gram-negative bacteria, gram-positive bacteria like actinomyces. And so now we're seeing that in these water damaged buildings, like while the topic is mold, that there's also these other microorganisms that can still contribute to essentially this water damaged building syndrome. And so the panel 7 is the most thorough panel on the market that I've seen for a home mold test as far as really being able to look at all of these microorganisms. If you're going to do strictly mold, you could do an ERMI is a really great test, or if you want to get a reduced version of the ERMI and look for the most important molds from a biotoxin perspective, you could do the HERTSMI. But if you're going to be really thorough, I would do the panel 7.
I've never heard of the panel 7. I'm going to look that up. Have you looked into Pure Maintenance at all and the work that they're doing for mold?
No, but it sounds like I need to.
Yeah, I think that would be right up your alley. Pure Maintenance is usually who we use, and they are nationwide, and they do a really good job with it. But I'm going to look into this. Now, sometimes this is going to sound crazy, but you might agree with me. Sometimes people won't change things for their health, but if it's impacting their pets, they will. So does mold impact dogs and cats and pets as well?
You know, it's funny. I haven't seen anybody that have pets in their house say that their pets are impacted. It's not something I can,
Hard though.
what's that?
It's hard though
It
because you can't
is.
have talk to this pet and say, "How do you feel on a scale of 1 to 10?"
And
Right?
that's where I was going to go. It's like, exactly. It's hard for that reason. And it's also like most people that I'm working with are not taking their pets into the vet to specifically do this. I do know there's like a really common staph microorganism called marcons that we says
Mm.
very, very common in mold. And I did have one patient test his dog for marcons to see if marcons actually was transmitted to the dog, and his dog had marcons. So that was definitely interesting from the veterinary perspective. But yeah, it's a really interesting question. Like in some ways, it would make so much sense that it would affect them too, but it also is a
Yeah.
genetic condition. And like, does that genetic
Mm.
condition exist in our home pets? And I don't know the answer to that, but I like the question.
Yeah, I don't know the answer either. I can tell you anecdotally that my dog, when we lived in the house that had mold, his energy levels definitely decreased as a result.
Okay.
So I did notice that just by paying attention to him. He wanted shorter walks, more shade, less sun, and he was, pretty young back then. He's now just turned 9, but back then he was like 3 or 4 years old, which is pretty young. So that is interesting, and I think it's a good question to ponder. But number one is do a test, get a test done, verify if you have mold. If you do, then you can do something about it. Do you put any value in the visual contrast test, looking at vision as a way of like mold toxicity?
Oh man, I go back and forth with this one. Like it is a test that we're using in the clinic at this point, but I am really honestly at this point questioning the utility because I'm not seeing like it's a conversation that I'm actively going back and forth with my business partner because I don't feel like with what I've seen, I don't feel like I've seen a strong correlation with like changes on the VCS and improvement in symptoms, but I know other people in the field do. So this is, kind of the conundrum or the quandary I would say for me with that test at this point is it valuable? Because I personally don't see, but I also trust my colleagues that are using it and like, hey, this works really, really well. So for me, it's a questionable thing that I am holding with an extremely open curiosity and a very meticulous eye right now.
Yeah, good answer. I used to use it often, and I actually stopped using it because I wasn't convinced about it either. I just thought it was more of kind of a distraction. So other things that we can do that I felt were better. So I'm kind of on the same page as you. I know the book has a lot more information on what to do if you have mold and the proper way to get it out of your body, how long it takes. Do you need to get rid of all your stuff? You can learn about that in the book. But maybe if you could give my audience a couple of general rules of thumb to follow. If you do have mold, what are the next steps for you?
Yeah, the biggest thing is to really understand if you do have mold, how much you have. So using those tests that we talked about, whether it's the panel 7 or the company you mentioned, using those tests will really help you identify not just what molds are there, but the quantity of those molds. And so the big thing is the quantity is high enough, you really are going to have to move. Like it just, it's probably, I would say, for those of us in the mold profession, we can do a panel discussion. We all have like slightly different opinions on like, oh, how we treat and these sorts of things. But probably the one thing that is going to be most likely in a panel discussion that you will find us mold literate docs, agree upon is that it's really, really difficult, if not impossible, to get somebody well in a house that is severely moldy. So that's definitely take home point number one. You can also remediate. It doesn't mean you have to leave. It just means the mold has to disappear. You can stay or go,
Yes.
depending upon what you want to do, right? So that's a really, really big point. Another thing in talking about, say, this panel discussion that I find that so many people get confused about, because there's a lot of us talking about this topic. And of course, we all have different approaches. And so, my clients will come to me and be like, do you use this approach, or do you use this approach, or do you this approach? And what are your beliefs? And my beliefs are probably in some ways, maybe frustrating for people because they're not clear cut, because my general belief is it depends. And so what works for one person is not going to be the same that works for another person. So my encouragement to listeners would be, try something in a methodical way, in a way you can test, in a way that you're not pushing your system too hard. And if it doesn't work, then that's not the thing for you, and move on to a different treatment strategy and that sort of thing. So definitely not one treatment strategy. And one other point that I think is super, super important to make about mold and detox in general, and this kind of overlaps with Lyme a little bit, is the concept of herxing and detox and die-off. And herxing is a little more associated with die-off reactions, but the concept with mold is really the same, which is you start to detox somebody and there's more toxins that the body starts processing through the liver than the liver can keep up with. And as we're processing all of these things, the body starts feeling worse. So if migraines are your thing from mold, all of a sudden you've had the worst migraine in your whole life. And some people really feel and kind of talk about the herxing, the die-off, the detox, whatever we're labeling these reactions as. Some people really talk about these as being like push through them. You got to get through it. And what I have seen is for most people, that's not the right thing. A better thing is like, why are you not detoxing? What's not working? How can we do this in a better way? Because that process is really inflaming you, and that typically I see that if we push that process too long, it actually takes the overarching treatment way longer, because now we have to calm your system. And now you might not respond well to some of these products that you would have if we just did this in a slower way and really listen to the feedback loop from your body.
Well said. Yeah, there's a lot of moving parts here. That's why it's important to get the book, reach out to Dr. Diane Mueller and learn more. You want to take mold serious because it's a serious thing. A lot of people are probably going to do maybe the remediation or maybe even move to a different place. But if they don't detox the mold out of their body, they're not going to get well, correct? They still need to, first of all, remove the source. The second step, they got to get it out of their body because it'll stay there unless you get it out, correct?
Correct. Yeah, exactly. That's the thing with having that immunological problem, is it's just going to build up and stay there. And it does, like when we are out of that moldy environment, right, we can see symptomatic improvement. But as far as really getting the health back on track, we need to support the detoxification systems that are not working correctly because of the immune problem, and actually go on a full-on, detox program, which does not mean that, you have to go on like a water fast or anything crazy like that. It just means that we need to support the actions of detox in your body so that your body does that process better.
When you started to study mold and how to detox mold, who were some of the people that you studied? Was it like Dr. Richie Shoemaker? Was it anybody in the field that really stood out to you?
Yeah, I definitely went through a lot of his Dr. Richie Shoemaker's work online. I didn't like do his like formal training, but I did read a lot of his work online and studied his 11-step protocol. Never really did that entirely, start to finish that mechanism, because I do tend towards more natural methods, but I do pull pieces out of that, and like to be studied in other people in the field, so I know what other people are doing. So definitely did, work on that. And then a lot of really working with mold is understanding detox processes. So like Dr. Chris Shade from Quicksilver Labs, like friend and colleague of mine, I've learned so much from him, and he's really helped from a detox perspective and figuring out missing links. So some of it was finding certain people that specialized in it. Others were more of people like Dr. Shade, which is like, okay, it's not really just about mold, but it's really about understanding detox at this really, really granular level.
Yeah, I love Dr. Chris Shade's work as well. Um, I remember when I was in my moldy home, I had frequent urination. Is that a common symptom too? Like, why did I get frequent urination?
Yeah. So when we have mold, one of the things that will oftentimes lower for people is antidiuretic hormone. So antidiuretic hormone is that hormone that signals our kidney to reabsorb water, so we don't basically urinate it all out. And when we have mold, for some people, not for everybody, we'll actually see a decline in this hormone level, and then we don't have that signal to the kidney to reabsorb water. And when that signal's missing, then we wind up urinating more of our water out. And that's like the chronic person that is like, or the person that is chronically thirsty and they're always drinking. They're like, no matter how much I drink, I can never alleviate the thirst. That's often a keynote sign. And you can test for antidiuretic hormone. You can also test for osmolality, which will give us similar information.
Yeah, well said. Yeah, that's interesting.
Yeah.
Okay, let's transition down to Lyme, right? A lot of people think, yeah, I don't live in the Northeast or New England. Like, I've never been bit by a tick. I don't have to worry about Lyme, but let's debunk that right now.
Yeah. Oh man, there's so much to say on this. So first of all, like Lyme is very, very ubiquitous. It's everywhere. I should say it's largely everywhere. There's this songbird that has been identified that actually, and I talk about this in the book, the songbird actually carries larvae of infected ticks. And as the songbird flies and it basically defecates over the earth, it's basically dropping wherever in its fly zone these infected tick larvae. And so the tick
Wow.
then, breed, and all of a sudden we have a new population of these infected ticks and their related diseases. There's also very limited studies, but there are a couple studies that have shown that Lyme and Borrelia burgdorferi, the bacteria that causes Lyme, has been found in mosquitoes and fleas. So that's another thing, even when we're thinking about, okay, this like, okay, if I'm not in the woods and I'm not around these deer ticks and all these different things, now we're actually seeing like, oh, you're on a lake and you just get bit by a bunch of mosquitoes. There's potential that could also be a way of transmitting Lyme as well. So those are, a couple of things for people to know around, this isn't just a, Northeast type of thing. And this can happen in many more common situations. I know there was a study in San Francisco, and I don't remember I wish I had the exact percentage, but it was really, really high. They went through a lot of the parks in the Bay Area and the city, and they were actually testing the number of parks that they found Lyme disease in. And I don't remember the exact number, but I know it was more than half. So it was a lot. So, that's another example of like, we're even seeing this research showing like, here we find it here we find it in these other areas. But yet, unfortunately, it's not reaching mainstream as quickly as I would love for it to reach mainstream.
Yeah, well, I mean, doing a good job making sure it does now. And this episode is going to get to a lot of people. Your book is doing a good job of explaining that. So now we have everybody's attention. If you live in where it doesn't matter where you live, you got songbirds pooping on you, you
Right.
got mosquitoes and fleas. This is an issue for a lot of people. So when Lyme comes in the form of bacteria, right? Different bacteria. Explain what happens when that enters the body. What does that do to the immune system? What does that do to our system in general?
Yeah, so a couple different things here. I mean, one is to just take a step back to also help people understand this. With Lyme, when we're saying it's bacteria, it's this bacteria called Borrelia burgdorferi. And the other thing I want people to be aware of is there's other species of Borrelia. So there's Borrelia miyamotoi, for example. And this is not classically Lyme because it's not Borrelia burgdorferi, but it can cause a lot of the same symptoms. But if you're only looking for Lyme, all of these other species are not going to show up. So
That's a good
when
point.
we're talking about Lyme, I want to kind of open up this conversation as far as what happens in your question to all these different species of Borrelia. One being Borrelia burgdorferi, aka Lyme. Two being all these other species of Borrelia that can largely cause similar symptoms. And so, one of the biggest things when we get these infections is these Borrelia species they have the ability to morph. They have different, what we call morphologies. And morphologies, you can look at them as like just different shapes of the microorganism. And so, one of the reasons this is important is because these three different shapes also, and the ability of the Borrelia to change between these three different shapes also allows the Borrelia to evade our immune system. Because if our immune system has figured out, oh, it's in this one shape, and then all of a sudden the Borrelia, because it's really an intelligent microorganism, it will switch to a new shape and the immune system has to figure that out, right? So
Wow.
yeah, it's crazy. I
It's
always
a shapeshifter. It's a
it's
clever little bastard.
yeah, it's like it puts
Jeez.
on costumes and nobody can find it,
Jeez. That's evil.
Yeah, it's quite evil. I have all these theories about, Lyme being an alien species, but we can talk about that another time. But
Wow. Yeah. Well, that's interesting. Is that in your book? I don't remember
no,
seeing
no,
that.
no. This is just one thing I do in my evening time.
So it shifts the shape so the immune system doesn't recognize it so it could penetrate and get to where it wants to get to.
Correct.
Now, if the immune system starts recognizing these new shifts and then it creates an autoimmune response, like the immune system goes on overdrive. Is that what could happen or
It
no?
definitely could, because
Okay.
Lyme can certainly trigger autoimmune disease. Like autoimmune disease, we have that genetic predisposition, and then we have that epigenetic trigger, that it causes that gene to express. So the epigenetic trigger could be Lyme. So it can be that, yes, we have a autoimmune disease, lupus, and we have all of a sudden we have Lyme disease. Lupus was never expressed. It's been genetically dormant. Lyme is that trigger. So we can certainly have that happen, but it's not necessarily an autoimmune response that happens. So it's from a standpoint of like autoimmune disease, where our immune system's on overdrive, it starts attacking our own tissues. It's not necessarily what's happening. Now, what does happen though is because Lyme has one of its shapes is this corkscrew type of shape. And then Lyme also has flagella. So it's like almost like these tails that make it like pretty motile. And so because of the corkscrew shape, you can imagine like this corkscrew just driving into our tissues. And so that's part of how Lyme's able to move. It's how it's able to go inside of our cells and hide. And so that's part of what it's doing when it gets into the body, is almost like spreading out in all these places. In part, it's looking for its food source. One of its main food sources is hyaluronic acid. That's why we see a lot of Lyme in places like the eye and our joints, because these are huge resources of one of its energy sources. But largely, it just is traveling in the body, looking for its food source, burrowing from tissues, evading our immune system, and changing shapes.
That's interesting. So it loves hyaluronic acid. So you find it more so around the eyes and where else did you say?
Joints.
Where eyes and
Yeah.
joints. So is it eating away at that hyaluronic acid, essentially aging us? People will feel like they're getting older faster with this.
Correct. Yep. And that's why we can see some of the joint pain, is
Jeez.
because we're actually wearing down, we get inflammation and we're wearing down our joint tissue there with that hyaluronic
This
acid.
thing, this alien evil thing is bad.
It's bad. It's bad. Get this alien species out of us.
So let's talk about that. I know that there's a lot of pitfalls with conventional medicine and how it treats Lyme, and I want you to share those false negatives and then how to do it the right way. And I love the lab that you use. I use them too. So go ahead.
Yeah, yeah. So the lab I use is Vibrant Wellness, and I use them because they are just, I think, the most thorough on the market. They use a couple different
They're
testing
awesome.
technologies. Yeah, they're amazing to work with. They test for so many of these species of Borrelia, and really, I think they're the most thorough test on the market. I get $0 for saying that. I just think they're the best.
Same.
Yeah, so they're super wonderful. And then controversial wise, one of the biggest controversial topics really comes around the topic of doxycycline. So doxycycline, the most common antibiotic that is prescribed for Lyme, is prescribed that because the form that we are contracting when we're talking about these different shapes, the form that we contract, basically doxy works quite well on. The problem is doxy will actually cause 90 something percentage of that particular shape to morph into a more dormant form of the Lyme disease. And so people get better because we're clearing the most active form, and the research supports that. But there's these subsequent studies which are really showing that so much of the doxy is creating these more dormant forms. And so then it's like we're temporary better. We think we don't like Lyme's not even on our radar because we treated it. And then years later, we have all of these Lyme related symptoms, which happen to be very similar to mold related symptoms. And nobody even is looking for Lyme because that was something that happened in the past. And
Wow.
so I'm not saying that doxy shouldn't be used, but the idea of using doxy, if we're doing an antibiotic and we're going that route, and I use them sometimes. I use a lot of natural methods, predominantly. There are times for antibiotics though. And when using something like doxy, it's really, really important to be combining the treatment with some of these other methodologies to basically help prevent this whole dormancy thing from happening.
Yeah, that's interesting. I mean, not to mention what the antibiotic is doing to your gut microbiome, right? The impact of that,
Yeah.
which is hard to get back even from one round.
Yeah.
You also mentioned that 60, what was it? 66% chance of a false negative with the conventional way of testing Lyme. Is that right?
Yeah. So basically, the conventional way of testing Lyme is using a test called the ELISA. And how this test works and how the diagnostics works is the ELISA is kind of the gold standard preliminary test. And if the ELISA is positive, only if it shows up positive, then the test is what's called reflux, is basically within the secondary test is ordered. And that secondary test is the Western blot. Now, what's interesting is the Western blot is actually more likely to show up positive than the ELISA. The ELISA has that 66% chance of the false negative, but yet we're using it as that gold standard. So there's this huge false negative, 66% percent chance, really, really huge. And we don't even make it diagnostically into the secondary testing, which the Western blot has its own problems, but we
Yeah.
don't even make it that far if you're in that 66% of that false negative.
That's wild.
Yeah.
That is insane. It reminds me of how they test for like H. pylori, for example. It's like that. It's like the analogy that I heard about that is like putting a bucket in a river and seeing what comes up there. It's like, yeah, you might catch something, you might not, but it's like that doesn't really work. It's not accurate.
Yeah. Yeah.
Test
Parasites are that way too.
yeah, exactly. So the test is Vibrant Wellness Tick-Borne Panel. You do need a practitioner to order that. Dr. Diane Mueller could be your practitioner. What's your website for them to reach out to you?
So the easiest website to find me is actually just my name because it has my book on there, it has my clinic on there, all of that. So if you just go to drdianemueller.com, you'll find my clinic, you'll find my book. I have a training program for docs. So that's where you can just find all of the things in one place.
Awesome. We'll put it down below, but we're not done. We have still a lot of ground to cover. We still haven't touched upon my favorite part of your work in your book, which is the brain, the mindset, the limbic system. We're going to get there. We're going to end the conversation with that. Before we get there, I want to talk more about hidden infections. So we spoke about mold. Quick question on mold, by the way, before we move on. I remember when I had mold, Dr. Pompa told me I had mold eyes, these hollow eyes, and that kind of got a lot better. But why does that happen, mold eyes?
I have not heard honestly that term and looked that up specifically. So I can't say for 100%, but I can presume. So my
Okay.
best educated guess on that is due to the amount of water that's lost, due to the change in, because we get a lot of electrolyte change in mold, in part because of the large amount of dehydration. So a lot of our chemicals from an electrolyte standpoint, that chemical conductivity standpoint is off. So that could cause it. In Chinese medicine, that because I also have my doctorate in Chinese medicine, and in Chinese medicine, that sort of symptom is often talked about from a kidney perspective. So, from a Chinese medicine perspective, we would say, oh, there's something going on the kidneys, which is also interesting, right? Because that kind of brings us back to the whole dehydration picture.
Yeah, yeah.
So I haven't, researched that exact symptom to say 100% why mechanistically, but that would be my best educated guess.
Yeah, that's a good guess because I remember at that time I was doing keto, I was doing fasting, I had mold exposure, and I was doing CrossFit. I mean, talk about dehydration. That definitely factored into it.
Yeah.
It does mold like Lyme also eat away at hyaluronic acid?
No, but mold just causes so much tissue inflammation. So you can still have a lot of joint pain, but it's going to be less of eating away at that hyaluronic acid and more just due to the extreme inflammation. It will
Got it.
actually, break down cartilage, and you see some of that stuff happening due to the inflammation, but I'm in the inflammatory cytokines and that sort of thing, but not directly on hyaluronic acid that I've ever found in research.
Okay.
Yeah.
Okay. And now let's talk about heavy metals, which is another, form of hidden stress or hidden infection.
Yeah.
I had eight I had 8 silver fillings in my mouth for 20 plus years, right? Silver amalgam fillings, super toxic mercury vaporizing into the brain, causing chronic low-grade inflammation. So I got them out from a biological dentist. Very important. Don't go to a regular dentist. Go to a holistic biological dentist, IAOMT.org to find one. And 2 sessions, 4 out, detox the right way. So let's talk about metals. What have you seen with metals causing mercury, lead, cadmium, heavy metals causing these issues with inflammation and just hyperactive immune system, all that stuff?
So I definitely say, and so in 12 years of working in this field, I have not seen metals as a standalone, meaning like I've never once tested one person and seen you only have metals as a problem and you don't have all of these other toxic accumulation issues. So in my opinion, I see it like not saying that couldn't happen. Like it
Yeah.
definitely could. It's just not been what's walked into my clinic. And so, when I've really worked with metals, it's been a huge part of just raising that toxic load, right? Because toxins, like the way I describe toxins to make sure everybody really truly understands, is like in some ways it's like this is very very oversimplistic, but in some ways it's almost like you have a mug of say or a tea, a cup of tea, and with every drop of tea that goes into that mug, that represents toxin, right? And symptoms don't really truly manifest until you reach that last drop, cup spills over. Other than that, your body is detoxing, you're getting things out as it's coming in. So the big thing with metals, like absolutely, I mean, we know, the impact on brain fog. We know the impact on the inflammatory effect on the nervous system. We know the impact on things like our gut and fungal infections and how metals can really worsen fungal infections. We've seen things like metals impact on kidneys and kidney inflammation. So we know all of these areas, right, that metals do affect us, as standalone. Typically, in the most common way I see metals, though, really is as a piece of this whole biotoxic accumulation picture. And it's just one of the things that typically are that we need to detox out of many.
Yeah, absolutely. We do. What about breast implants? I know that breast implants kind of have all of these things we mentioned, right? Breast implants could have mold. I don't know if it could have Lyme. You could let me know. But metals could be in breast implants. I mean, they find a whole host of things. So, what about breast implant illness?
I mean, it's a very real thing. I mean, I definitely have dealt with several people in my practice, not a ton, but several people who've gotten breast implants out. And then all of a sudden, like, wow, I'm 50% better, like right after surgery, and we haven't even done anything else yet. So it's definitely a huge, I think, important topic. Some of it is I think they get infected, inflamed. Others is that the actual implants can start leaking and getting into the system. So it can look a couple different ways. But yeah, it can be a breeding ground for these toxins. I haven't ever seen anything about the breast implants actually housing Lyme. I'd be very curious about that. Like to me, that would make sense, but I haven't seen anything studied specifically on that.
Yeah, me neither. So I'm curious as well. I know that I've seen studies that breast implants do house mold and metals, but
Yeah.
Lyme, I'm not sure. Either way, it's a hidden stressor, something that we want to deal with the right way.
Yes.
Okay, now let's get to my favorite part of your book, which is the title, right? Using your mind. I love studying the mind. Of course, as you know, we have the conscious mind and we have the subconscious mind. We have the brain and different parts of the brain. So I'm going to share with you, Diane, my challenges that I think you've probably seen with people who have gone through being sick, getting out of the exposure, mold, fillings out, doing detox, but the brain not catching up, the limbic system not catching up. So I remember I was out of my mold exposure, moved into a brand new apartment here in Bay Harbor Islands, did detox, I did all the things, but I would get into an elevator. Somebody had cologne. Oh my gosh, my immune system. And I'm like heart racing, get into an Uber, air freshener, heart racing. And my brain would like say, go save yourself. So what was happening to me?
Yeah, I totally relate. So, for like my version of that was like when after I got out of all my own mold stuff, and the moment I would travel and be like at a, thinking about like, oh my gosh, okay, this hotel, this Airbnb, this VR, like, and I would start going into panic. So it's almost like a PTSD, right?
Hmm.
So my favorite way of saying it, I actually learned from Dr. Joe Dispenza. The concept, the way he says it is nerves that fire together, wire together. And obviously, by the title of my book, I like things that rhyme. So I like that concept, right? Because it's really is a simplistic way of understanding. And it's like when the body is in this fight or flight survival thing, like when we have mold illness, there's a couple of things that are happening. One is that our threshold before a nerve fires changes, meaning for healthy people, we have this stimulus that will actually have to be created and for a nerve to fire and make something happen, give us information. And so the stimulus, if it's not a stimulus at a certain level, then the nerve doesn't fire. So an easy example is like, oh, you hear a dog barking across the street. The nervous system is, in health, like, okay, that's just a dog. I don't need to pay attention to that. We don't go in survival mode. But then when we have mold, because of all the neuroinflammation, the stimulus changes and the threshold lowers. And so then all of a sudden, whoa, that dog barking across the street is just driving me nuts, right? Because it's impacting us and the stimulus has changed. So nerves that fire together, that wire together. So that happens long enough, and we have the threshold of impulse that has actually been reprogrammed this way because of all of that. So that's one thing. And the other is like this PTSD type of thing, which is like really is very, very similar in a say less acutely impactful way, like, being in war and that sort of thing, of hearing, the classic example of like, veteran were coming back from war and they hear like a car backfiring and all of a sudden they're like taking cover, right? Because it sounded like something that reminded them of their time in the service. And
Yeah.
so it's similar with, with mold that way, where it's like we recover from it, but the nerves that have wired together are now firing differently to different levels of stimuli. So you smell cologne and all of a sudden it's like, oh, that stimuli threshold is still right there. And then secondarily, it's enough of a reminder to the nervous system from like a PTSD perspective, where the subconscious trigger is like, I'm in danger, and the danger response goes off much quicker.
Hmm. Well said. That's exactly what was happening to me. So what I did was, in that situation, I would just remind myself, you're healthy, you're safe, your body's protecting you. Like, and I would have kind of forced myself to go through the situation instead of running. And it's gotten a lot better over time. There are scenarios where, I walk in and there's a lot of cologne. I'm like, whoa, that person put on a lot of cologne. What's wrong with them? But then I would kind of just, become aware of my thoughts and go through it. So your book talks a lot about that. You mentioned Joe Dispenza in the book as well. And you chose to actually put that on your title, like use your mind. So why is it so important to become aware of those 60,000 thoughts that we have every single day?
Yeah, I chose to put that on the title, even though, as from reading the book, there's so much stuff in the body there, and it's definitely not a mind only book by any means. But I chose that specifically for the title because I feel like it's still an area where we're not talking about as much in the Lyme and mold community. And so it's really to largely just make the point of we get so excited about the protocols and the treatment and all these things, and part of that really needs to be working with the mind, because it's all these triggers we're talking about, but like I say in the book, it's like remembering my own history, and like I talk to my clients about this too, about this body scan thing that happens where it's like wake up and it's morning and wake up and it's like, what's wrong with me today, what's wrong with me, what's wrong with me. And so all of these types of subconscious thoughts, that are just firing because it feels like we can't control them because we haven't learned how to control them yet. And those types of thoughts are actually secreting cortisol, they're secreting adrenaline. And so they're really ramping up the process of the PTSD and that sort of thing. And how we get ahead of it, if we're going to stay away from anti-anxiety medications, which I would recommend for most people, how we get ahead of that is actually to get to the root of what's triggering those things. And if we're not in a truly an acute situation that really is fight or flight, what's triggering cortisol, what's triggering adrenaline, largely has so much to do with what we're thinking.
Yeah. It's not just the mold and Lyme space that fails to work on the, I call the inner size. It's the entire health space. You're so right. You nailed it. I agree. Mental six pack. It's so
Yep.
important, more so than a physical one. You want a mental one. So I love that you emphasize that in your book. It's very, very important. So the book is called Use Your Mind to Heal Your Mold and Lyme. It rhymes. It's available. Where's the best place for them to get it, actually?
You can find it, like I said, right off drdianemueller.com. You can also go directly to Amazon and just search for it on there and it'll come up.
We'll put both those links down below. Chapter 15 is the one where you discuss the mind and the thoughts and all that good stuff, which is very important. Don't neglect the inner work. That's the fundamentals. Everything works better when you have a strong foundation, and mindset is part of that.
Yes.
Where else, Diane, would you like for them to check you out? Social media, you mentioned the website, but anywhere else?
Yeah, I mean, you can find me on Instagram. I've been kind of playing around with TikTok. I do have a business coaching program also for female entrepreneurs. So if there's anybody listening that's in that space, you can find that at femmeetsfortune.com. You can also find that link on my main name website. So largely, if you go to my main, name website, you'll find all of that. But you can find me on Instagram and those kind of places too. Yeah.
Great. How are you liking TikTok?
I'm actually really initially I was like really having a hard time with it, but I'm starting to get into the groove of it. And I'm really actually enjoying kind of the artistic creative part of being like, I have 15 seconds to say something in a creative, fun way. So I'm just starting to, I feel like, understand the platform a little bit more as far as how to get the best out of it. But Monday's my marketing day, and the TikToks I made on Monday, I got done. I'm like, that was real fun.
I love it. Yeah, TikTok is an interesting place. That's actually, it surpassed our biggest platform. We're about to hit 300,000 followers on there. Is yours? Thank you. Is yours Medicine with Heart on there as well?
I have one Medicine with Heart. I have another Femme Meets Fortune.
So I'm gonna follow the Medicine with Heart now. Oh, there we go. I see it right here. Cool. I'm gonna start following you there to see your fun stuff.
Ask
The last thing that we'll end the conversation with and land the plane. I always talk about this vitamin that I believe is the most potent, strongest vitamin in the world. You can't overdose on it. It's free. It's called vitamin G. And Dr. Joe Dispenza has actually done brain scans. You know where I'm getting to. He's done brain scans on individuals. They take vitamin G. 1,200 chemical reactions go on instantaneously. They put the body in this anti-inflammatory state. And it's the practice of gratitude, being in a grateful, abundant state, which is right in line with your chapter 15. So my question to you is, what are you grateful for today?
I'm grateful for being here. I'm grateful for meeting my 3-week-old nephew this weekend and getting some baby love. I'm grateful for being able to work out every day. I'm grateful for snowboarding, for my guitar, for my supportive community, my family, so many things.
I love that. So many things. And what you appreciate. So I appreciate you, Diane. Thanks for coming on the show. Thank you for your awesome book. I can't wait for the second edition as well. You're doing amazing work. Honestly, you're getting to the root cause of so many people who just don't feel well, even though they're doing the best supplements and nutrition, but they just are discovering new things with your work. So thank you so much for coming on the show.
Oh, thank you, Ben. It's been a pleasure. Thanks, everybody.